Hello everyone, welcome. I am Sivasubramanian, a fourth year B.V.Sc and 8 student, and today we are diving deep into one of the most commonly diagnosed endocrine disorders in small animal medicine, hypothyroidism in dogs. This video is going to cover everything from the very definition of hypothyroidism right through to classification, the hormones involved, epidemiology, clinical science, diagnosis, and finally the treatment. It's a full clinical package. This video is purely educational and is not a substitute for professional veterinary advice. Alright, let's start with the very foundation. What exactly is hypothyroidism? By definition, hypothyroidism is a clinical syndrome that results from the inadequate production and or secretion of thyroid hormones, specifically T3, which is triiodothyronine, and T4, which is thyroxine, by the thyroid gland. And that inadequacy leads to a decreased basal metabolic rate, the BMR, which essentially means the dog's entire metabolism slows down. And when metabolism slows, virtually every system in the body feels it. As you can see on the slide, the affected hormones are T3 and T4. The gland involved is the thyroid gland, a bilobed structure located right adjacent to the trachea at the thoracic inlet. And the key consequence? A systemic metabolic slowdown affecting almost every organ. Here is a fun fact to lock this in. Hypothyroidism is the most commonly diagnosed endocrine disorder in dogs. So, this is something every veterinarian will encounter in clinical practice. Now that we know what hypothyroidism is, let's talk about how we classify it. We classify hypothyroidism by its origin, essentially where in the hormonal cascade has the problem occurred. First up, primary hypothyroidism. This accounts for a whopping 95% of all cases in dogs. The problem here is directly in the thyroid gland itself. It comes in two main forms: lymphocytic thyroiditis, which is immune mediated. The dog's own immune system attacks the thyroid gland, and idiopathic follicular atrophy, where the thyroid tissue progressively gets replaced by fat and fibrous tissue without any inflammation. Both end result not enough T3 and T4. Next is secondary hypothyroidism. This is rare. Here, the thyroid itself is fine, but there is deficiency of thyroid stimulating hormone from the anterior pituitary, usually caused by pituitary tumors, trauma, or congenital pituitary abnormalities. Then we have tertiary hypothyroidism. Very rare. This is a deficiency of thyrotropin releasing hormone from the hypothalamus. Congenital hypothyroidism is present at birth and leads to a condition called cretinism. These are puppies with disproportionate dwarfism, mental dullness, and delayed dentition. And finally, iatrogenic hypothyroidism. This is something we as clinicians actually cause, following bilateral thyroidectomy for thyroid carcinoma or after radioiodine therapy. Now, let's talk hormones. Let's trace the hypothalamic pituitary thyroid axis, the HPT axis. It works like a chain of command. At the top is the hypothalamus, which releases thyrotropin releasing hormone. Thyrotropin releasing hormone signals the anterior pituitary to release thyroid stimulating hormone. TSH then acts on the thyroid gland, stimulating it to produce and release thyroid hormones, predominantly T4, which makes up to about 80% of what the thyroid secretes. T4 then gets converted in the peripheral tissues, mainly in the liver and kidneys, into the active form T3, which is about 3 to 5 times more potent than T4. And here is the elegant part: negative feedback. When T3 and T4 levels are adequate in the blood, they loop back and suppress both the hypothalamus and the pituitary to shut off TRH and TSH production. It's a beautifully self regulating system. Now, why does all of this matter? Because look at the list of physiological functions that thyroid hormones regulate. Thyroid hormones control the basal metabolic rate. They are essential for normal growth and skeletal development. They regulate cardiac rate and contractility. They are critical for central nervous system development and function. They regulate reproductive cycles. They stimulate erythropoiesis, the production of blood cells. They maintain normal skin and hair follicle cycling. They are responsible for lipid metabolism and cholesterol clearance. They regulate GI motility and they maintain muscle tone and neuromuscular function. Now take a moment to look at that list. And suddenly, when thyroid hormones are deficient, every single one of these functions get compromised. That's why hypothyroidism is a truly multisystemic disease. Epidemiologically, hypothyroidism affects approximately 1 in every 200 to 500 dogs, making it incredibly common. The mean age at diagnosis is around 7 years, squarely placing this in the middle-aged dog category. We see it predominantly in the medium to large breed dogs. The Golden Retriever and the Doberman Pinscher are consistently among the most overrepresented breeds. So, if a middle aged Golden Retriever walks into your clinic looking lethargic and overweight, hypothyroidism should immediately be on your differential list. Here's a quick visual look at some of the most commonly predisposed breeds, from the classic Golden Retriever and the elegant Doberman Pinscher to the ever popular Labrador Retriever. Let's now move on to what actually brings these dogs into your clinic, the clinical signs. Now we get to the heart of the clinical picture. What does a hypothyroid dog actually look like when it comes into your clinic? Let's start with the metabolic and general signs. Weight gain without any increase in appetite. The dog eats the same amount, but the metabolism has slowed down so dramatically that the calories aren't being burned. Lethargy and exercise intolerance. These dogs sleep more, they are slow. They seem uninterested in play. Cold intolerance. They'll seek out warm spots in the house because their thermoregulation is impaired. Mental dullness. Owners often describe their dog as not acting like themselves. Bradycardia, a slow heart rate, and occasionally GI signs like constipation. One particularly striking clinical sign is the barrel chested appearance that some dogs develop due to accumulation of fluid and changes in the body composition. On the neuromuscular side, which is less common but clinically very important, we may see peripheral neuropathy, facial nerve paralysis, vestibular signs, megaesophagus, and generalized myopathy. Most of the signs develop slowly and are often not noticed by veterinarian examining the patient for the first time. These signs can sometimes be the only presenting complaint, which is why hypothyroidism is always worth considering a neurological workup. Now, on to what is arguably the most classic and virtually striking presentation of hypothyroidism, the dermatological signs. These occur in 60 to 80% of hypothyroid dogs, making skin and coat changes the most common clinical presentation. The hallmark is bilaterally symmetrical alopecia, hair loss that occurs on both sides of the body symmetrically, typically affecting the trunk, the tail, which gives us the classic rat tail appearance on the dorsal nose. The coat itself becomes dry, dull, and brittle and often fails to regrow after clipping. Myxedema is another striking finding, a thickening and puffiness of the facial skin, particularly around the eyes and forehead, giving the dog what clinicians call a tragic expression, a sad, puffy, droopy face. We also see hyperpigmentation, lichenification, and seborrhea. And secondary bacterial pyoderma can develop because the compromised skin barrier allows opportunistic infections. On the reproductive side, though less commonly recognized, we can see prolonged anestrus and infertility in females, lactation, inappropriate milk production, fetal resorption, and testicular atrophy in males. Alright, now that we know who gets it and what it looks like, how do we confirm the diagnosis? Let's walk through the stepwise diagnostic approach. Step 1, History and clinical examination. You're looking for the breed, the age, the classic dermatological signs, the obesity, the lethargy. You must also rule out other differentials, particularly hyperadrenocorticism. Step 2, CBC and serum biochemistry. These are your basic screening tools. You will classically find a normocytic, normochromic, non-regenerative anemia. Fasting hypercholesterolemia is seen in 75% of the cases, often above 300 mg per deciliter. Elevated CK, elevated ALP, and hypertriglyceridemia is also seen. Step 3, Total T4 or TT4. This is your screening test. Here's a key clinical pearl. A normal TT4 essentially rules out hypothyroidism. However, A low TT4 alone is not sufficient for diagnosis because conditions like euthyroid 6 syndrome, where non-thyroidal illness suppresses T4, can give you a false low. The reference range is 1.5 to 3.5 micrograms per deciliter. Step 4. Endogenous TSH. This is your confirmatory test. Remember the negative feedback loop? In primary hypothyroidism, there is no T4 to suppress TSH. So TSH goes up. Elevated TSH combined with low TT4 is strongly suggestive of primary hypothyroidism. Note, though that the sensitivity is only about 70%, so about 30% of hypothyroid dogs will have a normal TSH, which is why you use both tests together. Step 5. Free T4 by equilibrium dialysis. This is the gold standard single diagnostic test. It measures only the biological active, unbound fraction of T4, making it unaffected by binding proteins or concurrent illness. The reference range is 0.8 to 3.5 nanograms per deciliter. Step 6. TSH stimulation test. This is the reference standard. You administer bovine TSH at the rate of 0.1 international units per kg intravenously and measure T4 at 0 and 6 hours. A hypothyroid dog will show less than a 1.5-fold increase or will remain subnormal. And here is the diagnostic algorithm in a nutshell. Low TT4 plus elevated TSH point strongly to primary hypothyroidism. Confirm with free T4 equilibrium dialysis if needed. A therapeutic trial with levothyroxine and a positive clinical response further cements the diagnosis. And remember, a normal TT4 effectively excludes hypothyroidism. Great news! Hypothyroidism is eminently treatable, and the treatment is elegantly simple. Thyroid hormone replacement will need to be administered lifelong. This is one reason why every attempt should be made to ensure correct diagnosis before commencing the treatment. The drug of choice is synthetic sodium levothyroxine, LT4. This is a synthetic version of T4 hormone. Why T4 and why not T3, you might ask? Because T4 is the pro-hormone. It gets converted to the active T3 in peripheral tissues, which means the body self-regulates how much active T3 it actually needs. This makes dosing safer and more physiological. The dose is 20 micrograms per kg administered orally once daily. Some clinicians prefer to start with a divided BID dosing initially and then consolidate to SID. Maximum dose is 800 micrograms twice daily for very large dogs. Critically, it must be given on an empty stomach, ideally 1 hour before food, because dietary fat and fiber can significantly impair absorption. Now, monitoring is absolutely essential. You start your recheck approximately 4 to 6 weeks after beginning therapy. Once the dog is stable, biannual rechecks are recommended. What's the clinical response timeline? Within 1 to 3 weeks, owners notice improved energy and alertness. By 4 to 8 weeks, weight loss begins and coat quality starts improving. At 3 to 6 months, hair growth rebegins. Cholesterol normalizes and the skin starts healing. Full coat regrowth and partial resolution of neuropathy can take 6 to 12 months. One important warning: watch out for thyrotoxicosis from oversupplementation. Signs include polyuria, polydipsia, polyphagia, weight loss, panting, tachycardia, restlessness, and aggression. If you see these signs, reduce the dose immediately. All the information in this video is based on our class notes and supported by key peer-reviewed literature, including seminal work by Dr. Pansera on hypothyroidism in dogs. Both his 1994 study in the JAWMA and his comprehensive 2013 chapter in Clinical Endocrinology of Companion Animals. If you want to dive deeper, I strongly recommend these references. And that's a wrap on hypothyroidism in dogs. We cover the definition, the classification, the HPT axis, and all the critical physiological roles of thyroid hormones, the epidemiology, breed predisposition, full spectrum of clinical signs from skin to brain to reproduction, the stepwise diagnostic approach, the simplicity of levothyroxine therapy. If you found this video helpful, please give it a thumbs up. It genuinely helps the channel grow and reach more vet students like you. Subscribe so you don't miss the next video in the series. And if you have any questions or topics you would like covered next, drop them in the comments below. This is Veterinary Science Simplified, helping you to understand complex clinical concepts one video at a time. Thank you so much for watching, and I'll see you in the next one. Bye.